It is important to recognize that there are risks associated with sleep that can lead to serious health issues, including the possibility of death. Being aware of these risks can help you take necessary precautions for your well-being. There are 7 seemingly harmless nocturnal habits that could pose serious risks for individuals over the age of 70. Consider the unsettling possibility of drifting off to sleep one night and not awakening the next day. It's a thought that can evoke deep concern and reflection on the fragility of life. It certainly evokes a sense of concern, doesn't it? It is important to recognize that after reaching the age of 70, certain nighttime behaviors can pose significant risks, potentially leading to serious health issues like heart attacks, strokes, and even the possibility of sudden death during sleep. It is concerning that many individuals remain unaware that seemingly minor behaviors before bedtime could be undermining their health. Could you be unknowingly making some of these mistakes? This video reveals 7 seemingly harmless nighttime habits that could jeopardize your well-being. The latter habit poses significant risks, and it's concerning how many individuals engage in it without a second thought. Please reconsider that decision for your own safety. It's important that we begin this process carefully and thoughtfully. The first habit to be aware of is the potentially harmful practice of eating late at night, which can put significant strain on your heart. Are you aware of the potential consequences of eating late at night? Feeling hungry before bedtime might appear to be a minor issue, but for individuals over the age of 70, this behavior can pose significant risks. As we age, the human body undergoes significant changes that can affect its functioning. As we age, it's important to recognize that our metabolism and digestion can slow down, and our cardiovascular system may become increasingly sensitive to any excess strain. This is a crucial time to pay attention to our body's signals and make mindful choices for our health. Eating before bed, particularly heavy meals, can significantly disrupt your body's natural rest and recovery processes during the night. It's important to be mindful of how this can affect your overall well-being. Consider the significant effects this may have on the heart. Research shows that consuming food late at night may lead to significant increases in blood pressure, alterations in heart rate, and could potentially provoke arrhythmias. It is important to be aware that consuming fatty foods or those high in refined carbohydrates can lead to elevated blood sugar levels, which may contribute to the buildup of fat in the arteries. This excessive strain may result in serious health issues such as heart attacks or silent strokes occurring during sleep. There is a hidden danger that many people fail to recognize. It is important for seniors to pay attention to the subtle signals their bodies may send after a late meal. Ignoring these signs can lead to potential health issues that could be avoided with a little awareness. It's important to recognize that symptoms like heartburn, burning in the chest, and reflux are not just common inconveniences. They can signal underlying issues that may result in more serious complications if left unaddressed. Gastroesophageal reflux is a common issue, especially among those who eat shortly before going to bed. When you lie down too soon after a meal, stomach acid can back up into the esophagus. This can cause irritation and inflammation, making sleep uncomfortable and less restorative. Over time, this repeated reflux may lead to more serious complications, such as breathing difficulties or even aspiration pneumonia. This condition is especially dangerous for older adults. Moreover, reflux has the potential to provoke episodes of sleep apnea, a serious condition characterized by repeated interruptions in breathing during the night, which can lead to decreased oxygen levels in the blood. This can place additional stress on the heart, potentially resulting in significant cardiovascular issues. What steps can we take to mitigate this risk? While it may seem daunting, altering this habit can be straightforward and lead to quick improvements in your health. It is important to consider the following essential recommendations. Please ensure that you have your dinner at least 3 hours prior to going to bed. This practice can significantly impact your sleep quality and overall well-being. This period is crucial for your body to effectively process food while ensuring that your rest remains undisturbed. It is important to be mindful of your dietary choices, particularly when it comes to fatty foods that contain high levels of refined carbohydrates. Making informed decisions can greatly impact your health. Consider replacing pasta, fried foods, and sweets with lighter options such as proteins, vegetables, and whole grains. This change can significantly benefit your health. It is important to slightly elevate the head of the bed for better comfort and support. This may assist in alleviating reflux and enhancing digestion. When considering a snack before bedtime, it's important to opt for something light to ensure a restful night's sleep. Consider choosing fruit, plain yogurt, or a handful of nuts, as they are all beneficial options for your health. Implementing these straightforward changes can help you prevent excessive strain on your heart, enhance your sleep quality, and greatly lower the chances of experiencing complications during the night. However, this is merely the initial critical error. The next habit is particularly concerning as it encompasses an action that many engage in daily, often without recognizing the potential dangers involved. The second habit to be aware of is the potential risk associated with consuming excessive amounts of water before bedtime. It is crucial to recognize the importance of drinking water for maintaining health, particularly as we grow older. It is important to be aware that consuming excessive fluids before bedtime can lead to negative consequences rather than positive ones. Be mindful if you tend to consume significant amounts of water or tea right before going to bed, as this practice can lead to potential issues that you might not be aware of. The issue extends well beyond the frequent nighttime trips to the bathroom. Engaging in this seemingly harmless action may elevate the chances of experiencing falls, variations in blood pressure, and potentially serious heart issues. It is important to understand the potential risks associated with consuming excessive fluids at night. This practice can lead to various health issues, including disrupted sleep patterns and increased trips to the bathroom, which may affect your overall well-being. Being mindful of your fluid intake during the evening hours is crucial for maintaining a healthy lifestyle. As we grow older, it is important to recognize that the functioning of the kidneys undergoes significant changes. Throughout the night, blood filtration persists. However, it is important to note that the bladder's capacity to store urine is diminishing. Be mindful that consuming a significant amount of water before bedtime can greatly elevate the likelihood of waking up multiple times during the night to urinate. It's important to recognize the genuine risks involved. Be mindful that when you rise in the middle of the night to use the bathroom, there is a significant risk of falling. It's important to take precautions to ensure your safety during these moments. Research indicates that falls during the night are a significant factor leading to hospital admissions among older adults. In low-light conditions, when the body is still asleep and blood pressure may drop due to a change in position, it is crucial to be aware that the likelihood of experiencing dizziness, fainting, or even fractures significantly increases. Moreover, an accumulation of excess fluids can place significant strain on the heart. While you sleep, it's important to understand that your body significantly slows down the heart rate and modifies blood circulation to prioritize rest. This process is crucial for your overall well-being. Excessive water consumption at night can lead to elevated blood pressure and an increased heart rate as the body works to manage the extra fluid. This poses serious risks, especially for individuals with pre-existing heart conditions. Sleep disruptions caused by frequent awakenings may also contribute to cognitive decline over time. Chronic sleep deprivation can impair memory, increase inflammation in the brain, and raise the risk of developing dementia and Alzheimer's disease. Prioritizing good sleep isn't just about rest. It's essential for protecting your heart and brain health. What steps can we take to mitigate this risk? Recognize that you can prevent this issue by making a few straightforward adjustments to your routine. It's important to stay hydrated throughout the day, but please be mindful to limit your water consumption in the hours leading up to bedtime. It is advisable to refrain from consuming large quantities of fluids at least 2 hours prior to going to bed. It is advisable to steer clear of diuretic drinks in the evening to prevent potential disruptions to your sleep and overall well-being. Be mindful that beverages such as coffee, black tea, green tea, and certain juices may lead to increased urine production, potentially exacerbating the issue at hand. If you find yourself feeling thirsty before bedtime, it's advisable to take only a few small sips of water to stay hydrated without overdoing it. It is important to steer clear of large glasses or whole bottles. When you rise during the night, please remember to turn on a gentle light and proceed with care. This is crucial in avoiding unexpected falls and feelings of dizziness. By adhering to these recommendations, you can enhance your sleep quality, lower the likelihood of nighttime falls, and safeguard your cardiovascular health. It is important to exercise caution. One potentially harmful habit could be hindering your body's ability to recover effectively while you sleep. It's important to recognize that you might be making this mistake without being aware of it. The third habit is essential to consider. What are the potential life-threatening risks associated with sleeping in a hot room? On a cold night, it's common for individuals to seek warmth through heaters, weighted blankets, and by closing off rooms to create a cozy sleeping environment. However, it's important to be mindful of safety while doing so. It is important to recognize that excess heat during sleep poses significant risks for individuals over 70 years old. It is important for seniors to be aware that maintaining a bedroom temperature that is too high can pose serious health risks, including cardiovascular issues, dehydration, and even the potential for sudden death during sleep. It is crucial for the human body to maintain its internal temperature in order to achieve a deep and restorative rest. When environmental temperatures rise excessively, it can severely disrupt the body's regulatory functions, leading to harmful effects on health. Sleeping in a scorching environment can lead to several concerning effects on your health and well-being. It may disrupt your sleep cycle, making it difficult to achieve restful sleep. Additionally, overheating can cause dehydration and increase the risk of heat illnesses. It's crucial to be aware of these potential risks and take steps to ensure a comfortable sleeping environment. It is important to understand that our body instinctively reduces its internal temperature during the night, a crucial process that supports deep and restorative sleep. Body cooling plays a crucial role in supporting metabolic processes that are vital for tissue recovery and memory consolidation. In scorching conditions, the body faces significant challenges as it strives to release excess heat. This increased demand can place a strain on the heart and disrupt the ability to rest effectively. Moreover, high temperatures can result in nighttime dehydration, which poses a particularly serious risk for older adults. Recognizing that the body's overnight fluid loss due to sweating can cause the blood to thicken is crucial. This change can elevate the risk of serious health issues such as thrombosis, stroke, and heart attacks. Staying hydrated is crucial for your well-being. It is important to recognize that a room that is excessively warm can disrupt deep sleep cycles. This can lead to frequent awakenings throughout the night, often without the individual being aware of it. A lack of quality sleep can lead to serious health issues, including elevated blood pressure. The patient has impaired brain function and a compromised immune system. Taking steps to ensure adequate rest is crucial for maintaining overall well-being. If you are already living with heart or respiratory disease, the implications can be even more serious. Your health may be at greater risk, and it is important to stay informed and take necessary precautions. Please consult with a healthcare professional to understand your specific situation and the best steps to take. Individuals with heart conditions, including hypertension or heart failure, they should pay particular attention to their sleeping environment. High temperatures can pose significant risks to individuals' health. The body faces increased demands as it strives to regulate its internal temperature, leading to heightened exertion from the heart. It is important to recognize that this additional strain can lead to serious health issues, including episodes of arrhythmia, elevated blood pressure, and potentially heart attacks. Individuals dealing with respiratory conditions like COPD or asthma should be aware that a stuffy, hot room can significantly exacerbate their symptoms. This environment can hinder breathing and lead to decreased blood oxygen levels, which is a serious concern that requires immediate attention. What are the best practices for maintaining the optimal temperature in your bedroom to ensure a safe and restful sleep? It is important to recognize that even minor adjustments in the bedroom environment can significantly lower this risk and promote safer sleep practices. It is important to maintain the room temperature within the range of 18 degrees Celsius to 22 degrees Celsius for optimal comfort and well-being. This is the optimal period for achieving restful and secure sleep. Please be mindful to steer clear of blankets that are excessively heavy or thick sleepwear. It is advisable to choose lightweight and breathable fabrics like cotton for your comfort and well-being. It is advisable to use a fan or humidifier to enhance air circulation in your environment. This measure is essential to avoid excessive heat accumulation in the room. Please consider leaving a window slightly open to promote natural ventilation, as this can be beneficial for air quality. This is essential for maintaining fresh air and minimizing the chances of overheating. Making these straightforward adjustments can significantly safeguard your heart, enhance your breathing, and promote deeper, more secure sleep. Having recognized that a hot room can pose significant risks, it's important to prepare yourself for the next potentially harmful habit. It pertains to a common behavior that many individuals engage in unknowingly, which can greatly elevate the risk of experiencing a stroke. The fourth habit to consider is that the position in which you sleep could potentially elevate your risk of stroke. Many individuals maintain the same sleeping position for extended periods, often without realizing the potential negative impact it could have on their health. However, once you reach the age of 70, the manner in which you lie down can significantly impact both your quality of life and your safety. Research suggests that specific sleeping positions may elevate the risk of stroke, disrupt blood circulation, and potentially affect breathing while you sleep. It's important to be aware of these factors for your health and well-being. It's important to take a moment to reflect on this issue, as neglecting it could lead to serious consequences down the line. What sleeping position should be avoided after age 70? For seniors, particularly those dealing with high blood pressure, sleep apnea, or heart issues, sleeping on your back poses significant risks that should not be overlooked. Sleeping in this position may lead to the tongue and throat tissues partially obstructing the airway, which can decrease the oxygen supply to the brain. Episodes of obstructive sleep apnea can occur, which is a serious condition that results in breathing interruptions throughout the night. It is important to recognize that a prolonged deficiency in oxygen can lead to serious health consequences, including potential brain damage, elevated blood pressure, and an increased likelihood of experiencing strokes and heart attacks. Please take this information seriously for your well-being. Moreover, sleeping on your back may impede blood circulation, particularly for individuals who are already facing vascular issues. It's important to be mindful of this potential risk. It is important to recognize that compromised blood flow can lead to the formation of clots, a significant factor contributing to ischemic stroke. Is sleeping on the right side a beneficial choice? While many believe that side sleeping is generally safe, it is important to understand that resting on the right side may inadvertently place stress on the heart. This is a crucial consideration for those who prioritize their cardiovascular health. It is important to be aware that this position may exert pressure on the inferior vena cava, a significant blood vessel responsible for returning blood to the heart. Please consider this carefully. It is important to be aware that this can impede circulation, leading to increased fluid retention and a heightened risk of heart failure. What is the most suitable sleeping position for individuals over 70? Experts strongly advise that sleeping on the left side is the most beneficial position. Adopting this posture can significantly enhance blood circulation, aid in digestion, and lower the likelihood of experiencing gastric reflux. It's important to be mindful of these benefits for your overall well-being. This position is important as it promotes better blood flow to the brain, which can significantly lower the risk of experiencing a stroke while sleeping. What steps can you take to move toward a more secure position? Transitioning from your usual sleeping positions, such as on your back or right side, can be quite challenging. It's important to approach this change with care and understanding. There are certain strategies that may provide you with valuable assistance. It is important to use a firm pillow between your knees to help maintain proper spinal alignment. This small adjustment can make a significant difference in your comfort and overall well-being. This enhancement not only increases comfort, but also plays a crucial role in preventing back pain. It is important to place a pillow behind your back to help prevent rolling into an uncomfortable position while you sleep at night. This is essential for maintaining proper body alignment on the left side. Consider using an orthopedic neck pillow for better support and comfort. Be mindful that making adjustments in your position can significantly enhance your breathing and help avert neck pain. If you experience reflux, it is advisable to consider elevating the head of your bed slightly for relief. This alleviates the burning sensation and enhances breathing capabilities. Implementing this change is crucial for lowering the risk of stroke, enhancing circulation, and ensuring safer, more restorative sleep. Understanding the significance of your sleeping position is crucial. It's time to learn about a habit that could lead to dizziness, severe falls, and even fainting during the night. The fifth habit is a critical mistake that could lead to fainting or falling when you rise from bed. Have you ever experienced dizziness or a brief darkening of your vision upon getting out of bed? It's important to pay attention to these sensations, as they could indicate an underlying issue that warrants further consideration. This is a critical alert that demands your attention, particularly for those over the age of 70. Rising suddenly during the night can result in a rapid decrease in blood pressure, which may lead to feelings of dizziness, a lack of balance, and in some cases, fainting. It's important to be mindful of this risk. Postural hypertension is a significant concern, as it is one of the leading contributors to falls and fractures among the elderly population. Picture this: you wake up at dawn, the need to use the bathroom pulling you from sleep. You rise too quickly, and in an instant the ground seems to vanish beneath you, leaving you in a disorienting moment of uncertainty. When transitioning from a lying position to standing, it's important to be aware that blood circulation may take a few moments to adjust. This delay can result in fainting and potentially serious falls, so please take care during such movement. The hidden risks of nighttime falls, a serious concern for the elderly. Numerous incidents lead to serious injuries such as hip fractures, wrist injuries, and even head trauma. It is important to recognize that a seemingly minor fall can result in significant consequences, including loss of mobility, extended hospital stays, and, in some tragic instances, even death. A fall can significantly impact overall health, leading to a series of consequences that should not be overlooked. The apprehension of experiencing another fall can result in reduced movement, which in turn contributes to muscle mass loss, deteriorating balance, and an increased likelihood of future falls. It is important to recognize that some falls may occur due to unexpected fainting, which can be a serious concern. It is important to be aware that individuals with low blood pressure or dehydration may experience insufficient oxygen flow to the brain upon standing, which can result in a brief loss of consciousness. This situation requires attention and care. How can you prevent hazardous falls when getting out of bed? It is important to recognize that implementing a few straightforward adjustments can significantly reduce this risk. Please rise gradually. Upon waking, take a moment to sit on the edge of your bed and allow yourself a few seconds to gather your thoughts before fully rising. This small pause can be beneficial for your well-being. This is essential for the body to maintain proper blood pressure levels. It's important to have a glass of water close by your bed. Staying hydrated is essential for your well-being, especially during the night when you might wake up feeling thirsty. Make sure to prioritize this simple yet effective habit for your health. It is important to be mindful of dehydration. To help mitigate this risk, consider taking small sips of water before rising from bed. Consider utilizing night lights for added safety and comfort during the dark hours. Be aware that a poorly lit environment significantly heightens the risk of trips and falls. Please consider installing soft lights along the path to the bathroom for enhanced safety and comfort during nighttime visits. Please ensure you have stable support when raising your feet. Having a support at the head of the bed or a handrail nearby can significantly enhance your stability when getting up, ensuring your safety and comfort during this process. Please be mindful to steer clear of slippery clothing and carpets. Using bare feet or slippery socks may significantly heighten the risk of falls, so it's important to be mindful of your footwear choices. Please ensure you wear non-slip slippers for your safety. Implementing these strategies can greatly lower your chances of experiencing falls at night, safeguarding your health for the future. Having learned how to rise safely, it's crucial to turn your attention to a potentially hazardous habit that often goes unnoticed. This behavior could indicate that something significant is occurring within your body. This is referred to as the sixth habit. Be aware of the signs: snoring, pauses in breathing, and difficulty sleeping. These symptoms can indicate underlying issues that require attention. It is crucial to pay attention to this matter, as neglecting it could lead to serious consequences. It is a common misconception that snoring at night is a normal part of aging, but it is important to approach this issue with care and understanding. It is important to be aware that frequent snoring and brief pauses in breathing while sleeping may indicate a serious condition known as obstructive sleep apnea. It is crucial to address apnea promptly, as neglecting it can significantly heighten the chances of serious health issues such as heart attacks, strokes, and even sudden death. Understanding the effects of sleep apnea on your body is crucial. This condition can lead to a range of serious health issues if left unaddressed. It's important to be aware of the potential consequences and seek help if you suspect you might be affected. As you sleep, it's important to be aware that the muscles in your throat tend to relax. For certain individuals, this relaxation can lead to a situation where the airway becomes either partially or completely obstructed, hindering airflow. This can lead to the individual experiencing brief pauses in breathing multiple times throughout the night, often without their awareness. Whenever breathing ceases, there is a significant decrease in the oxygen levels in the blood, which compels the heart to exert more effort to make up for this deficiency. It is important to recognize that over time, this can result in elevated blood pressure, strain on the heart, and an increased risk of heart attack and stroke. Please take this information seriously and consider the implications for your health. Moreover, individuals experiencing apnea face significant challenges in attaining the deeper, more restorative stages of sleep. Extreme tiredness during the day can have serious consequences, such as impairing memory, increasing the risk of falls, and potentially contributing to the development of dementia and Alzheimer's. It is crucial to be aware of these risks and take them seriously. What are the signs that indicate you might have sleep apnea? It is important to recognize that numerous individuals suffering from apnea may be unaware of their condition. Often, it is a bed partner or a family member who first observes the signs of loud snoring, prolonged pauses in breathing, and occasional episodes of waking up feeling short of breath. It is important to be aware of other prevalent symptoms that may indicate an underlying issue. These can include a sensation of suffocation during the night, waking up with a dry mouth, experiencing headaches in the morning, persistent fatigue throughout the day, and excessive sleepiness despite having a full night's rest. If you or someone you know is experiencing these symptoms, it may be crucial to seek further evaluation. If you are experiencing these signs, it is crucial to consult a doctor and undergo a sleep examination as soon as possible. Insomnia may indicate that there is an underlying issue that needs attention. Alongside apnea, it is crucial to recognize another issue that often goes unnoticed: chronic insomnia. Experiencing persistent trouble sleeping or waking up multiple times throughout the night without a clear cause may indicate an underlying issue within your body that requires attention. It is important to recognize that insomnia may be associated with serious health issues, including cardiovascular problems, neurological disorders, and hormonal imbalances. Understanding these connections is crucial for your well-being. Moreover, insufficient sleep can significantly compromise the immune system and elevate stress levels, which may exacerbate serious health issues like hypertension and diabetes. It is crucial to prioritize adequate rest for your overall well-being. How can you enhance your sleep quality and mitigate potential risks? If you believe you may be experiencing apnea or are struggling with persistent insomnia, there are certain approaches that can provide assistance. It is advisable to refrain from sleeping on your back. This position can lead to airway obstruction and exacerbate apnea, which is a serious concern that requires immediate attention. It is advisable to consider sleeping on your side. It is important to prioritize maintaining a healthy weight for your overall well-being. It's important to recognize that excess fat around the neck may worsen sleep apnea, a condition that can have serious implications for your health. Taking proactive steps to address this issue is crucial for your well-being. It is important to refrain from consuming alcohol and sedatives prior to bedtime. It is important to be aware that these substances can lead to an excessive relaxation of the throat muscles, potentially exacerbating the issue at hand. Establish a setting that promotes restful sleep. Creating a dark, quiet room with an optimal temperature is essential for enhancing the quality of your rest. Prioritize this environment to ensure you get the restorative sleep you need. Please consider using a CPAP machine if needed. This equipment plays a crucial role in maintaining open airways throughout the night, which is essential for achieving a safer and more restful sleep. Recognizing and addressing sleep disorders is crucial for enhancing your lifespan, lowering the risk of heart disease, and significantly improving your overall quality of life. Understanding the gravity of nighttime breathing issues is crucial. It's important to address a frequent error that numerous individuals commit before sleeping, which could be gradually harming your health. This mistake is commonly referred to as the seventh habit. It's important to be aware that the medication you take before bed could potentially have serious consequences for your health. For many individuals, particularly those over the age of 70, taking medication before bedtime has become a prevalent practice. It's important to approach this habit with care and awareness of its implications. While taking medication at night, such as sleeping pills, blood pressure medications, or muscle relaxants, may appear to be a harmless routine, it is important to approach this practice with care and awareness. It's important to understand the potential risks associated with certain medications during sleep. It is important to understand that certain medications may have significant effects on breathing, blood circulation, and brain function while you sleep. This is a crucial consideration that many may overlook. It is important to be aware that this can elevate the likelihood of falls and strokes and potentially lead to respiratory arrest. The risks associated with sedatives and sleeping pills are significant and should not be overlooked. Benzodiazepines, including diazepam, clonazepam, and alprazolam, are commonly prescribed for managing anxiety and insomnia. It is important to approach their use with care and awareness of potential risks. It is important to be aware that these drugs may reduce the activity of the central nervous system. This can result in slower and shallower breathing. Please take this information seriously and consider the implications for your health. For seniors, this situation poses significant risks, especially for those with existing heart or respiratory issues, including sleep apnea. We must not ignore these risks. It is also important to know that these medications may lead to dizziness and mental confusion upon waking. This can significantly increase the risk of falls and fractures. Some medications can quietly affect your breathing, circulation, and brain activity while you sleep, especially dangerous for older adults. This interference can significantly impact the quality of your rest, leading to potential effects on memory and cognitive function. Addressing high blood pressure too quickly can pose serious risks. It is crucial to approach this matter with care and consideration. It is important to recognize that many individuals rely on medications to manage their blood pressure, particularly before bedtime. While this may offer advantages in certain situations, it is crucial to recognize that some older adults may face an unforeseen danger, a sudden decrease in blood pressure while they sleep. Be aware that if the pressure falls too low, it can significantly diminish blood flow to the brain, which heightens the risk of experiencing an ischemic stroke while you sleep. It is important to be aware that extremely low blood pressure may lead to feelings of dizziness or even fainting when rising from bed in the early morning hours. Please take care when transitioning from a lying down position to standing. It is important to be mindful of the use of painkillers, as their indiscriminate use can put significant strain on your organs. It is important to note that many seniors use pain relievers like ibuprofen or diclofenac to alleviate muscle and joint pain before bedtime. However, we advise caution when using these medications as they may have side effects and interactions that could potentially affect health. Always consult with a healthcare professional to ensure safe usage. It is important to recognize that the regular use of these medications can place significant strain on the kidneys and liver, potentially hindering the body's ability to remove toxins effectively. It is important to be aware that certain anti-inflammatory painkillers may influence blood clotting, which can elevate the risk of internal bleeding and potentially lead to a hemorrhagic stroke. Please consider this information carefully. What steps can you take to reduce these risks? It is crucial to exercise care when taking medicine before bed to safeguard your health and well-being. Please consult with your doctor as soon as possible. It is crucial to avoid altering your medication regimen without consulting a healthcare professional. However, it is important to inquire about potentially safer alternatives that may be available for your situation. Please be mindful and steer clear of unnecessary sedative medications. For those seeking restful sleep, it's important to consider natural methods. Relaxing teas and breathing techniques can be beneficial options to explore. Please closely monitor your blood pressure levels. It is important to monitor your blood pressure regularly if you are taking high blood pressure medication at night. This will help ensure that your blood pressure does not drop too low while you are sleeping. Please be mindful of potential drug interactions. It is important to be aware that certain medications can amplify the effects of others, which may lead to a heightened risk of severe side effects. It is important to recognize that even minor adjustments to your medication routine can significantly impact your safety and overall well-being. Please take this seriously and consider the potential benefits of these changes. Having learned about the 7 silent nighttime habits that may jeopardize your well-being, it is crucial to take immediate steps to safeguard your health and promote safe, restorative sleep. Now is the time to make small changes that protect your health. After learning about the 7 nighttime habits that may quietly harm your well-being, it's important to take action. Even simple adjustments to your daily routine can lead to better health and a longer, more independent life. So what can you do today to sleep better and protect your heart, mind, and body? Try lowering the room temperature, changing your sleep position, or avoiding heavy meals before bed. These small steps can make a big difference in how well you rest. Every decision you make plays a role in your health. Safe, healthy sleep is more powerful than most people realize. Please take time to speak with your doctor and begin building habits that support a strong and peaceful future. Your health matters.